interesting that you bring up that the pay issue really can be kind of a market signal for women who savvy to it, to cause them to challenge themselves even further and maybe get more education or move in a different direction that better fits their talents. I know back in the 80s when I went to business school and when I was working, I remember even then that some of the early studies showed that when you accounted for education and experience, the pay gap was very minimal. And I think that's even been borne out more today, as I've seen studies by the Congressional Budget Office, by the head who was a woman at the time, that bore that out. And the one approach that one of the congresswomen mentioned yesterday was the idea of flex time as being the Republican approach rather than equal pay for equal work. A lot of women, rather than being given comp time or given the pay issue or having to work overtime, they'd rather have comp time and flex time so that they can maybe blog or do something more creative.
Yes, and that's
or
absolutely
spend time with their families, depending on what their experience is.
Exactly, and in my own experience just recently, we had to deal in my office with a flex time issue. One of my coworkers had a serious family issue that she needed to deal with. So she decided to work 12-hour days so she could have one day off in order to be able to handle this issue. And we were able to accommodate her. That is a wonderful benefit. That is something I would like to have in the future when I get married, when I have children, that I have this ability to have flex time. That's more important to me than to push equal pay, because I will be paid. I will be paid for the work that I do, and employers that look at you and see the work that you can give them will pay you. And if they're not, you need to reassess your situation and perhaps leave. So I never want to attach any kind of equality, because, and honestly, there isn't an equality.
Everyone's unique.
Everyone's
really.
unique. Even in my profession, I have a dual degree, and
tell us about your profession.
Okay, I work in an inner city hospital. I work in infectious disease. I absolutely adore my job. It is the perfect fit for me. It is part education, it is part advocacy, it is part learning something new every day, it is part problem solving. I interact with everyone from the CEO to the environmental services cleaners in the hospital on a daily basis. I could not have found a better place to work. My coworkers, I hate to call them coworkers, they're mentors. We support each other in such a great way, and we balance each other with our personalities. And when we problem solve, we all get together and we all have different outlooks and can really get to the heart of the matter of the problem easily. Just love it.
That's great. That's good to hear. So since you work in a healthcare facility, do you have some opinion about the healthcare plans of each of the candidates, and let us know what your thinking is on that?
We actually looked carefully at Hillary Clinton's healthcare plan and found that there were some really glaring faults in it. It sounded great on the surface, but you have to realize for it all to work together, for it to pay for itself, every part of the healthcare package everyone had to be compliant. Now, as you know, compliance and healthcare issues are never on the same page. You have patients that are prescribed an antibiotic, and they're told to take it for 10 days. And even if they feel better, they need to take that antibiotic, and a lot of people don't. In my past, I've been guilty of that too. That would affect the Hillary healthcare plan. Everyone has to be compliant. It's dependent upon the compliance of each type of group, whether you're uninsured, whether you have a job, whether you're retired. You all have to maintain keeping up your prescriptions and following directions to maintain the balance in the healthcare. And we just thought that was kind of off. Considering the work I do,
human nature.
What I see every day in an inner city hospital, that would be difficult. My type of hospital would really put a strain on Hillary's healthcare system, Hillary's healthcare plan. It is a reflection of, unfortunately, the society of Philadelphia, and you can't just fix it by fixing the healthcare system. You have to look at other issues, the social issues, the economic issues, the education issues of these people.
So you looked at the McCain plan? Because I know as a mom, I like the idea of portability, that it's not tied to someone's job, and yet also, it seems to me that it could be more affordable because you have a little market-based competition in there, so that people can look at have the transparency in the costs, and kind of shop around for the best doctor or the best clinic to meet even tailor the plan to their family needs. Like, I'm past the point where I'm going to be pregnant, and so I don't need coverage like that, but I might need something for someone of my age. So you have some thinking about that?
You pretty much summed up my idea of it, and it goes back to a market-driven healthcare system. I would love it if our healthcare was not tied to our employment. That I could purchase healthcare like I purchase a car, that I purchase a home. Healthcare should just be a product, and in that sense, it encourages a better work ethic within the healthcare. They need to provide better care in order to get the business. They need to be more accountable. They need to be more transparent with their costs. It really would fix so many problems in healthcare by having more of a market drive to it, instead of having these gigantuan health care insurance companies that we have now that are really just controlling everything. You're taking that away and you're making them accountable. If they have to compete for your services, for your
you're like a consumer.
You're a consumer. Absolutely.
First, then.
Healthcare should be just as a commodity, just like a car is, just like a house is. And along with that, you will have regulations coming into play so that they are not gouging the market or giving substandard care. And I think in that effort, we have a lot of organizations, oversight organizations, in effect as well. We have JCAHO, Joint Commission. We have, your state health department.
Because you're a quality control.
What I like to see at the end of the day, at the end of my work day, is that I made sure that the patients in my hospital got the best care, not only from me, but from the nurses, the doctors, the physical therapists, the environmental service people, that we're all on the same team trying to, in my case, reduce infections, keeping the patients healthy that way, but making them do the right thing and work better. The same thing can be said with healthcare. We can do this as a nation. We can make healthcare better. Have you read the book Better, by the way?
No.
I suggest you do it. It was written by a surgeon who stepped back. It's inspiring to me. He stepped back and looked at his profession and thought, I'm a surgeon. Everyone thinks, I'm perfect. But then he started to critically look at every process of his day and realizing that there's things we can do better. And I think that is the same in healthcare. I think that is the same with our economy. I think that's the same with our personal lives. So.
Great. Well, it's been a real pleasure meeting you, Sky, and talking with you and sharing your thoughts with our Blog Her audience.
Hi, Blog Her.
So thanks a lot, and I probably will see you around the convention and look forward to your posts on Blogger.
Oh, great. Thank you so much.
Thanks, everyone.
Thanks.